This is a special edition of C-Show. Hi, I'm here. One of the big questions we've been getting since the COVID-19 vaccines came out is whether they can cause cancer. So let's talk about that. The COVID-19 pandemic has been hard for everyone, but it's been particularly hard for people who are dealing with or worried about cancer. It wasn't just the fear of catching COVID-19 that made many people delay needed medical care. For some, the worry of contracting COVID-19 in a hospital was so great that they skipped necessary cancer screenings or treatments. And for others, medical facilities were simply so overwhelmed with COVID patients that those other services got put on the back burner. As a result, millions of people didn't get the preventative care they needed, which can lead to more advanced stage cancers and worse health outcomes down the line. I know this personally. My partner was diagnosed with lymphoma just before the pandemic hit. I watched him go from being the picture of health to having his entire nervous system shut down due to a tumor the size of a football. Watching that was devastating, but not being able to get into the hospital to see him when he needed me the most was heartbreaking. So I totally get why some people would be afraid to go to the hospital, even for something like a screening, where they might end up contracting COVID. And that fear is understandable. But what I want to focus on today is how the pandemic affected our ability to detect and treat cancer early. That window of opportunity is critical because the earlier we find and treat cancer, the better chance we have at kicking it. So let's take a look at what we know about the relationship between cancer screenings and early detection. And one of the first things we need to consider is how many people don't know if they should get screened for certain types of cancer and how often. That includes people without symptoms. In 2021, only 43% of adults said they had received any cancer screening test within the previous year, which is kind of shocking. Maybe that's because more than half of Americans don't know the recommended screening guidelines for different types of cancer. And that number gets even higher when we look at specific racial and ethnic communities. According to research, American Indian, Alaska Native, Black and Hispanic populations have lower rates of cancer screenings than white populations. So many people aren't getting tested at all, and many more aren't getting tested as often as they should. If you're not sure if you're in the clear, please check with your doctor. But in general, there are some cancers we screen for before there are any signs or symptoms. For example, cervical cancer. Most cervical cancers develop from precancerous cells called cervical intraepithelial neoplasia, or CIN, and the human papillomavirus, or HPV, causes almost all cases of CIN, so we screen women for HPV, starting at age 21, whether or not they have symptoms. The good news is that there's an easy test for it. And if we catch it early enough, we can remove the precancerous cells before they turn into cancer. In fact, thanks to widespread use of the Pap smear test, which screens for these precancerous cells, cervical cancer used to be one of the leading causes of death in women. Now it's one of the most preventable. The death rate in the US has dropped more than 50% since the 1950s. So, regular screenings really do work. But the pandemic threw a wrench into that. During the pandemic, we saw fewer Pap smears being administered, fewer abnormal Pap smears being followed up on, and fewer cervical biopsies being done, but now things are looking up. By the end of 2022, Pap smears and HPV tests were back to 2019 levels. And we may see similar trends in other cancers too. Colorectal cancer is another one we screen for before symptoms appear. This type of cancer tends to develop slowly over time, which gives us an advantage. If we can detect the early precancerous stages, we can often remove the polyps before they become cancerous, and we have tests to do just that. The most common ones are called colonoscopies. But while colonoscopies were also delayed during the pandemic, by the end of 2022, they were back to 85% of pre-pandemic levels. And the benefits of early detection here are pretty huge. Between 2014 and 2019, colorectal cancer mortality rates fell 3.6% per year. So it looks like things are returning to normal, and that's fantastic. Unfortunately, that's not the case for breast cancer. There are two main tests we use to screen for breast cancer. The first one is a mammogram, which uses low-dose X-rays to see inside the breast tissue. Mammograms aren't perfect, which means sometimes they'll flag a small group of women for further testing when they don't actually have cancer. That's called a false positive. And that's annoying because it scares people and makes them undergo unnecessary procedures. But it's better than the alternative, a false negative. You don't want to miss a cancer that's there. So in 2019, nearly 40 million mammograms were performed. But during the pandemic, That number dipped to less than 36 million. And by the end of 2022, it had only recovered to about 37 million. And that's concerning because it's estimated that around 42,000 women died of breast cancer in 2022 alone. There is hope though. Another way we can screen for breast cancer is through a blood test that looks for proteins only found in breast cancer cells. And so far it's proven to be fairly accurate. It can tell us if someone has a 1.3% chance of having breast cancer. So if you're under 50 and have no family history of breast cancer, you probably don't need to get screened until you start feeling symptoms. For those at higher risk, we can also do MRI screenings. MRIs are better at finding tumors that are too small for mammograms, which could explain why breast cancer mortality rates were dropping about 2% a year between 2014 and 2019. But again, during the pandemic, fewer women got screened, and that trend hasn't totally recovered yet. One thing we have to remember, though, is that not every abnormal screening leads to cancer. Sometimes it could be something else like fibrocystic breasts, which are just benign cysts filled with fluid. Those are harmless, but they can make mammograms and MRs look weird. And if that happens, doctors usually recommend doing additional imaging like a fine needle aspiration biopsy. We do similar screening procedures for prostate cancer in men. We can check PSA levels and do digital rectal exams, which don't sound fun, but they can help identify abnormalities. And then if something seems off, we can do a prostate biopsy. And while screenings for prostate cancer did drop during the pandemic, they were back up by the end of 2022, so hopefully that will translate to better early detection rates. It's still too early to see the effects of decreased screenings during the pandemic on cancer mortality rates. But going forward, we need to continue encouraging people to get screened. We have a lot of tools to find cancer early, but we have to use them. And the best way to do that is to educate ourselves and our loved ones about what to expect and how important it is to catch cancer early. If you have questions about cancer screenings, please reach out to your healthcare provider to learn more. And for those of us who are lucky enough to be at low risk for certain cancers, we can support each other in getting screened. Because if you don't have the benefit of family members or friends gently reminding you to schedule and keep that appointment, you might forget, and that's okay. But we want to help each other remember because early detection saves lives. Thanks for watching this episode of C Show. If you would like to help support this channel, you can join our community on a crowdfunding platform.